Hello friends, welcome to Creative Medicine. In this lecture, we will learn about. Hello friends, let us now learn the limp, types of limp and pathology. So if you see the types of limp and pathology, one we have antalgic limp. In antalgic limp is seen in hip joint arthritis. Antalgic limp is seen in hip joint arthritis. Then we have Trendelenburg limp. In Trendelenburg limp, it is seen in weakness of hip abductors. It is seen in weakness of hip abductors. You will see Trendelenburg limp. Then high stepping gait. High stepping gait is seen in foot drop, which is secondary to peroneal nerve palsy. Foot drop secondary to peroneal nerve palsy. You will see high stepping gait. Then we have spastic limp. It is seen in cerebral palsy. In cerebral palsy, you will see spastic limp. Then ataxic limp is seen in cerebellar palsy. In cerebellar pathology, you will see ataxic limp. Thank you for watching. Thank you and thank you for watching.